So today we're going to talk about something called Bell's palsy. It's a condition that can cause sudden paralysis on one side of your face. Now, I know that sounds really alarming and confusing, but the most important thing to know right up front is that it's almost always temporary. So let's get into what it is and what you can expect.
Just imagine this. You wake up, you go to the mirror, you try to smile, and only half of your face gets the message. Your eye on one side won't blink, and your mouth is kind of drooping. It is a deeply unsettling experience, and it's totally natural for your mind to just jump to the absolute worst-case scenario.
And of course, that worst-case scenario is almost always a stroke. But here's a key difference that a doctor will look for right away. With a stroke, the paralysis often spares the forehead. That means you can still raise your eyebrows. But with Bell's palsy, the entire side of the face is affected, forehead included. So, and this is the wild part, being unable to raise your eyebrow on that side is actually a really strong sign that it is not a stroke.
Okay, so you've rushed to the doctor or the ER. What happens now? Let's walk through the whole diagnosis process, which, you might be surprised to hear, is often pretty straightforward. A doctor is typically going to follow 3 simple steps. First, they'll just talk to you, ask about your symptoms, your medical history, the usual stuff. Then comes the physical exam, where they'll ask you to do things like raise your eyebrows, smile big, and squeeze your eyes shut. And if they can rule out other causes just based on that exam, they can make the diagnosis of Bell's palsy, which has a more technical name, Idiopathic Peripheral Facial Paralysis. Now, this quote here comes straight from the official medical guidelines. It says, "Additional testing is not indicated." And honestly, this is so reassuring. It means that in a typical case, the diagnosis is so clear from just looking at you and talking to you that you usually don't need blood tests or CT scans or MRIs. To figure out how severe the paralysis is and to track your progress, doctors use something called the House-Brackmann scale. It's a simple grading system from grade 1, which is totally normal, all the way up to grade 6, which is complete paralysis. A really key point on this scale is grade 4, because that's the point where it becomes impossible to fully close your eye. And that becomes super important when we talk about treatment. So what is actually causing all of this to happen? Let's dive a little deeper into the science behind what's going on with that facial nerve. Remember that official name, Idiopathic Peripheral Facial Paralysis? Well, that first word, idiopathic, is really a clue. It's just a medical term that basically means we don't know the exact cause. And for about 2/3 of people who get this, a specific trigger is never found. But we do have a very strong leading theory. The best theory we have is that a dormant virus, often the same one that gives you cold sores, suddenly reactivates. When it wakes up, it causes the facial nerve to get all inflamed and swell up. Now the problem is, this nerve has to travel through a very narrow bony tunnel in your skull. So when the nerve swells, it gets pinched inside that tunnel, and the signals from your brain can't get through. And that's what leads to the paralysis. If this is happening to you, I know it can feel incredibly lonely, but you are definitely not alone. Bell's palsy affects about 20 to 30 people out of every 100,000 each year. To put that into perspective, your average family doctor will probably see a new case just once every couple of years. So it's really not that rare. It's just something we don't talk about very often.
All right, now for the part you've probably been waiting for. What can you actually do about it? Let's go over the standard treatment plan that's designed to help you recover as quickly and as completely as possible.
The treatment really comes down to 2 essential things. First, a course of corticosteroids like prednisolone to bring down that swelling in the nerve. And second, and this part is absolutely critical, is protective eye care.
So you might be wondering, do those steroids actually make a difference? Well, the data is pretty clear. If you do nothing, about 70% of people will make a full recovery. But if you start a course of steroids, ideally within the first 3 days, that number jumps up to around 80%. It gives you about a 10% better chance at a perfect outcome.
Okay, let's really focus on the eye for a second. If your eyelid can't close all the way, your cornea is just left exposed to the air. It can get dry, scratched, and that can lead to ulcers and even permanent vision damage. That's why protecting your eye is non-negotiable. During the day, that means using artificial tears or lubricating gels constantly. And at night, it means using a thick eye ointment and literally taping your eye shut with a patch or a bandage. So you've got your diagnosis, you've started the treatment, now comes the hard part, the waiting game. Let's take a look at the typical road to recovery and what you should expect along the way.
And we could start this section with some fantastic news. A huge majority, we're talking 85% of patients, will start to see some signs of recovery within the first 3 weeks. That first little twitch, that first flicker of movement you see, it is a massive, massive milestone.
This timeline here gives you a pretty good roadmap. The paralysis usually hits its peak over a day or two. Then, like we said, improvement starts for most people within 3 weeks. From there, your recovery can continue for up to 6 months, sometimes even longer. It really is a marathon, not a sprint, so patience is absolutely key.
Now, for the roughly 30% of people who don't get back to a full 100%, a common long-term effect is something called synkinesis. Basically, as those tiny nerve fibers regrow, they can get a little cross-wired. This means when you try to make one movement, like smiling, another muscle might fire off involuntarily, like your eye twitching. There's even a rare version of this called crocodile tears, where the act of eating can actually make your eye water.
So let's just quickly recap the most important things to take away from all this. Number 1, the overall prognosis is very, very good. Remember, that forehead test is a strong sign it is not a stroke. Steroid treatment can really help improve your odds of a full recovery, but protecting your eye is your number 1 job. And finally, you have to be patient with your body. This kind of healing just takes time.
And I'll leave you with this final thought to chew on. Experiencing something like Bell's palsy is a jarring, sudden loss of control over something as basic as your own face. But as those nerves slowly, quietly start to fire again, what can an experience like this teach us about our body's quiet, persistent, and pretty remarkable capacity to heal itself? Thanks for joining me for this explainer.